Hi nurselings. In this video we're going to talk a bit about exogenous insulin, meaning the insulin that is man-made, that is given to patients who either do not make enough or are not using the insulin that they make. This is something that can really trip people up when they're studying for exams, and that's because there are so many different kinds of insulins, and each of them have their own onset and peak and duration, and it's really important to know the difference in order to time administering the medication with the patient's meals. Thankfully, there's a pretty easy way to break it down. I'm going to go through and I'm going to let you know which things actually matter when you're studying and which things you don't need to worry about. Here we go. So this is super important, obviously. I'm sure you guys know this. Definitely something you have to know for the NCLEX and for work. So you've got these kind of 4 classifications of insulin. You have your rapid acting, short acting, intermediate acting, and long acting. It might seem a bit overwhelming, but you should be able to recognize them on the test. Let's compare rapid acting and short acting, because those are really the 2 that people get mixed up. Lispro and Aspart are your 2 main rapid acting. Those are generic names. You might see the name brand, but they'll almost always have those generic names on them. Aspart is NovaRapid, Lispro is Humalog, and then there's this new stuff, this Fiasp or I've never used it, but it's actually extra fast. So I just kind of put it started over here. Your rapid and short acting insulins are always clear, meaning like the liquid that you're putting in, if you're drawing it up, it's a clear liquid, it's not cloudy. Your rapid acting is going to kick in within 15 minutes. It's going to peak at about 2 hours, and then it's going to last anywhere between 3.5 to 5 hours. What's important out of all of these 3 is your onset, really. And that's because when you give insulin, we have to make sure the patient then eats. If we give insulin, we're going to drop their glucose. It's going to leave the blood and it's going to go into the cells and do all the things we talked about. So they could become hypoglycemic if they don't eat. This is kind of the thing that shows up on tests a lot, is having to know when that patient needs to eat. If you give them Aspart or if you give them Humulin R, when are they at risk for hypoglycemia? Because that's really what we're worried about when we're talking about these insulins. So this kind of new kind of Aspart here called Fiasp, this stuff is awesome. It kicks in 4 minutes, peaks in 1 to 2 hours, only lasts like 30 minutes to 1.5 hours. So this is when we need insulin to hit fast. 2 minutes before the start of the meal or within 20 minutes after. This is really the important thing that we need to know. So again, rapid acting, Lispro, Aspart, it's clear. We give it at mealtime, and the effects can last up to 5 hours after the injection, so you want to keep an eye on the patient. Again, it's all about the risk of hypoglycemia. So if you're giving it at mealtime, make sure they're going to eat. You got to keep an eye on that risk. Short acting, again, same thing. We're giving it at mealtime to kind of imitate that natural insulin release in the body. They always have regular or R in the name. So you're going to have regular insulin or Humulin R. It's always going to kind of be obvious that we're talking about regular insulin. I find, so that's really easy to remember. These intermediates always have like N or NPH. Novolin is an N, right? So you kind of know. I find the intermediates easy to recognize. The long actings are easy to recognize. Really, it's glargine or detamere. That's really all we're giving. I know there's a long list of a bunch of other ones, but these are the ones that are going to show up. Your Lantus and your Levemir. And then it's really just a matter of remembering, Aspart and Lispro. I mean, it's really the only thing left, right? So if you see Aspart or Lispro on a test, you know it's not regular because it doesn't have the word regular or an R in it. You know it's not intermediate because it's not N, NPH, or Novolin. And you know it's not Lantus or Detamere. So it's got to be a rapid acting. Short acting, again, this is your regular insulin. This is the stuff we're giving If the patient is in DKA and we give IV insulin, this is what we're giving. We're also using it before meals. You can actually combine this short-acting regular insulin with an intermediate acting insulin to kind of, we want to, everybody's different, right? And we want to try to get them as close as we can to imitating this kind of endogenous pattern. So onset now, instead of 15, it's 30 minutes. It peaks in 2 to 3 hours and lasts 6.5 to 7 hours. Again, this is like the norm. So this is the regular insulin. This is the norm. So I kind of always memorize this first and know that it's about 30 minutes. And then I just I know that if it's aspart, it's going to be a lot quicker. And these ones, these intermediates and long actings are really easy to recognize because they're really long acting, like 18 hours or 24 hours. You're never going to see a regular insulin that's going to last that long, 7-8 hours top. So again, your intermediate is going to be Humulin N, NPH, Novolin. This is your cloudy one. That cloudy. Onset in 1 to 3 hours, peaks 4 to 10 hours, up to 18 hours duration. Again, these numbers are quite big. You know when you see these, it's not going to be a short acting or a regular acting, because your short and regular are going to kick in within 30 minutes tops. If it takes 1 to 3 hours or an hour and a half to kick in, it's got to be intermediate or long acting. This is the stuff we're giving to kind of have that basal rate that's going underneath. And again, we can combine it with this regular acting. We can mix it together to tailor it to the patient's needs. And long acting is another kind of basal, right, that's keeping that rate coming a little bit all day. Again, most popular, glargine or detamir. This one is clear as well. The only one that's cloudy is your NPH, which is your intermediate. Onset in 90 minutes. Again, you see that, you're going to know it's not kicking in within 30 minutes. So it's a long acting. There's no peak because it just literally flows like this all day and it lasts 24 hours. So if you're asked a question, most likely the question will be framed something like, you've given your patient this, and they'll give you the name of it. What do you expect to happen, or when should the patient eat, or what have you? So you just kind of have to be able to recognize. You don't have to memorize. The long acting, we give it Q12, so bedtime and in the morning, or sometimes we'll only give it once a day. In the hospital, it's almost always given with the short acting as well, so that you have that basal rate going underneath, and then you also have that bolus happening with the regular or the short acting. All you need to worry about when you're talking about mixing insulins, we only mix regular and intermediate, and sometimes they come pre-mixed. For example, you can get this Novamix that's 30/70. It's 30% regular insulin, 70% NPH. So this is regular and this is intermediate, right? And they all are kind of like that. There's nothing really important. When you're hand mixing your insulin, you have to draw up the regular insulin first. And if you guys remember from any of your practical tests or whatever, it's cloudy, clear, clear, cloudy, right? And so you inject the air into the cloudy, then you inject the air into the clear, then you pull up the clear, then you pull up the cloudy. So you can just look at this and just do whatever you have to do to try to remember that. That often will show up on a test. Make sure you understand what a sliding scale is. If you look here, and this is really, really common, it'll tell you when you go to the patient at a certain time of day, you take their CVG and it's 12.1. It tells you how many units you need to give them. And this is a directive, so you don't have to get an order or anything. You just grab the pen and do it.